Hey guys, thanks for turning into Straight to the Core, an in-depth, no-nonsense look into all things physical therapy, wellness, and the business of being healthy. We are your hosts, Claire. I'm Mark's wife.
And I'm Mark, Claire's husband.
Today, we are talking about a little hot button item.
We're going to get real long-winded in
this
this one,
one-
probably. This is a big one.
Yeah. Youth sports.
Youth
the good, the bad, the
sports.
ugly, the truth behind youth sports.
This is going to be, and we see this firsthand all the time, every day. That's our biggest group of people coming in right now is young athletes.
Absolutely. I think it probably is important to start off by saying that obviously, you know, almost everything that we do every single day is to encourage people to be healthy and to be active. So even if you're not as healthy as maybe you want to be, you're post-op or you're in the middle of an injury, being active is so important. And what our rant might be about is, even though we're complaining about something, we are absolutely by no means trying to discourage anyone from being active. I think kids especially.
Yeah.
To counteract everything that we do that just in a regular everyday setting, being on our phones, being on our tablets, school now is online, you know, on a laptop, here's your work. I think being active is so critical to everybody's well-being, but especially kids.
Well, let's talk about, first of all, let's talk about what's good about sports, youth sports.
Okay.
My number one thing with youth sports is it teaches a sense of community, teamwork, hard work.
It teaches someone how to be coachable.
Yeah, winning and losing, and
yes.
that's part of life. And now
teaches
now
you
it gets to life.
how to be coachable both in a positive and negative. It teaches you how to receive negative feedback, right? And change something.
Well, presumably.
Yeah.
In the old days, perhaps. I don't know that people are quite up to good coachability anymore. But ideally, the template for the work life and the actual life is in sports life, where you work together with people and you get coached by somebody who's guiding you, and you work as a team and you fail and then you try again.
Identify why you failed, and you identify what needs to be worked on.
And then eventually
presumably
you'll succeed at some
you try
point.
to do that better, and then you win.
And I know, it's not about whether you win or lose, but it kind of is, unfortunately. Without winning, there is no fun in sports.
That's
but
right. I always say that.
Sorry, you got to try to win.
Yeah.
That's part of it, and that's okay. But you're not always going to win. Sometimes you lose. You lose more, or you learn more when you lose.
Right. Now, I think we see this all the time. And I say this all the time, and I need to probably start changing some of my dates of reference. But when we first started, some of the injuries that we saw in the kids that were making that transition from playing 3-4 sports in high school and now playing a single sport in college. And yes, I know that there are some smaller schools that kids can get out there and they can play multiple sports. Awesome. You know, like you get someone who runs track, and then they also happen to be like the running back or a receiver on a football team. Got it. But for the most part, if you were a 3 or 4 sport athlete, or even a 2-sport athlete in high school, you turn around and you're specializing in one sport. And some of those injuries that we used to see due to overuse of, making that transition, we now are seeing those same sorts of overuse injuries in a significantly younger population. Would you say that's true?
Absolutely, and I think that comes down to specialization of your sport. You don't have the cross training that we used to have 3-season athletes. Mm-hmm. We just don't see that as much. If you want to be a soccer player in college, in pro, whatever you want to do, you have to play pretty much only soccer, and you play it all year round, and there is nothing else you're going to be doing.
Right. And throughout that specialization, though, I mean, when you're a professional athlete or when you're making that transition into college, then you have at your disposal all of these resources, right? Like we talk all the time about Husker football and the days of victory. Yes.
Many fortnights ago.
When not only did we win, but like we weren't horrible. That was many months ago.
Husker pride.
Yeah. But, you think of the training table, you think of the strength and conditioning, and some of the best strength and conditioning research came out of that time period.
Out of Nebraska.
Yes. And you just had all these resources at your disposal, right? Mm-hmm. I mean, the Nebraska football team of the 90s had some of the best nutrition that you could
They
ask.
basically
And
pioneered strength and conditioning in basically most of the collegiate sports that we see today.
yes, and then probably some
And then they
supplementation as
and
well.
there was, of course, but we were not exclusively doing it.
Yes.
Also, that has all caught up. Everybody says, why is Nebraska football not as good as it used to be with our strength and conditioning? People just caught up. I think we were groundbreakers in the 90s, but everybody just caught up and figured it out. And, we didn't evolve well.
But you think of those resources, right? Where you take, let's say, some great local athletes, because a lot of those kids were local to Nebraska as well.
They were, yeah.
And you take these, farm kids who have functional strength, who were out throwing bales of hay, right? And you say, okay, now you're gonna specialize in football.
Yeah.
But to counteract the fact that you're doing the same thing, then we have the best medical staff. We have the best nutritionist. We have or nutrition for you. We have the best, strength and conditioning. We know when to rest you. We know when to push you, and so on and so forth. Kids now who are specializing in one sport at the age of 8, 10, they don't have that. They have their parents train them, blindly find their way, and not necessarily through the fault of the parents by any means. But I think that's huge. Like we're taking these tiny little bodies and these kids that are still growing, and we're turning around and we're kind of shoving them into that scenario that we were shoving college kids into.
Yeah, I think the whole climate changed, obviously, in a similar way, but a different way than society did when they started paying college athletes. I think that we had a problem before with youth injuries. We've got a lot of statistics that we looked up. There's 200,000 ACL surgeries in youth sports alone. It's a $40 billion industry per year. It's just incredible. Mm-hmm. But when we started paying college athletes big money, you are going to have more people pushing and training at a high level when you're 12, when you're 15, when you're 16, because you're signing at 16, you're signing at 17. And that pressure is huge now, because now college sports aren't free education.
It's an investment.
They're professionals,
right.
or semi-pro, paid professionals.
I pay now so you can
Correct.
pay me later sort of scenario.
And, I don't know that for most people, you're talking about 1% of the 1% who ever make money playing sports. It's supposed to be more about the skills you gain in life and sports. And unfortunately, there's a lot of youth that are destroying their bodies or hurting themselves in capacities that's unfortunately going to affect them forever. Usually something they're into, but sometimes we see parents are more into it and pushing their children into it more than the kids even want to. How many times in your career, this is a good one, have you worked with an athlete who's a good athlete, really good, college level, doesn't matter which level, that has an injury in high school, and you can tell they don't want to play anymore?
Well, yeah, I mean,
but their parents
times.
want them to get the scholarship because they spent all this money and all this travel, and it's just an incredible amount of money. But the kid doesn't really want to do it anymore.
Yeah. Well, and a lot of times those injuries that we see,
dozens of times I've seen this.
Yeah. Oh, countless. Yeah.
Per year.
And it's really sad, because there's definitely times that you can tell that the injury is either what kind of pushes a kid over the edge and they say, okay, I'm not doing this sport anymore, or they almost kind of use that injury as an excuse.
Yeah. Or they don't want to really recover because they don't want to go back because they're just tired.
Yeah. Or they get a small little taste of kind of what, regular life looks like.
Well, yeah, you see that with our gymnasts.
Yes. Oh, absolutely.
So gymnasts are training 3, 4, 5 hours per day, every day, 6 days a week. Most of their friends are gymnasts. They don't have time for social lives. That is a sport that is very involved.
Is within those same, the level or their team. And I think that's great for the camaraderie aspect of it.
It's a very intense sport. You have, multiple disciplines. You have to master, 4 events, 5 events?
Depending on male or female.
Yeah. So, those are different, skill levels. And I get it. But, man, there's a lot of stress on these bodies. And they don't have any social outlet other than their sport.
Right. Well, and I think, bringing up gymnastics, I think it's very, very interesting with youth sports in general. So gymnastics used to be, and I'm going to date myself here, but with the Carrie Strug kind of timeline, right? We looked at these little gymnasts, especially after her, oh my gosh, what what year would have that been? I was in high school when she stuck her landing. 90s?
96,
Yeah,
probably in
okay, so the
Atlanta,
96, yeah.
maybe, which was
So-
heroic by any standard.
Yes.
Absolutely.
But then you start looking at it and you think, oh gosh, like here's a grown man who basically told what, a 16-year-old kid, 17-year-old kid, I don't know how old she
I
was,
know
she
your
was at the
ankle
time.
hurts, but landed anyway.
Yeah. To basically suck it up, buttercup. And yes, she did it for her country to win the Olympics. And if you're going to suck it up one time in your life, that's probably when you do it. But still, you think of that kind of idea of here's a grown man telling a teenager to suck it up and do something that hurts and is potentially harmful anyway.
And for a young girl who will really never make enough money for it to be worth it.
Right.
So this is all about pride.
Right. So I think at that point you had some people kind of looking at this and saying like, ooh, okay, like gymnasts, there's a thing there, right? Like they're training so hard, and because of many, many factors that we could get into, gymnasts tend to be younger. And that's kind of how it has to be.
Peak very young.
Right. And I think for a very brief period of time, we were kind of looking at gymnastics with a critical eye and saying, I think we're pushing these kids' bodies too much, And then you look at some of these athletes as they stopped becoming competitive gymnasts, but they still looked like little girls, right? It's like they were working their bodies too hard, and they kind of pushed aside puberty, and they stayed pushed aside. And all of a sudden you're looking at, a 22, a 25, a 30-year-old Carrie Strug who still speaks like she's a little 12-year-old girl.
Yeah.
But then what happened, and this is interesting in sports in general with youth, instead of saying, whoa, we got to push back with what gymnastics is doing in terms of the intensity and the frequency and the volume of training with them, all of the other sports kind of started catching up. They thought, you know what? If gymnastics can get away with it, we can get away with it.
Well, and we forget to mention the one thing, but gymnastics is incredibly expensive. If you're a gymnastics athlete in town, you're looking at, I want to say $1,000 to $2,000 a month, depending on what you're doing per child. Mm-hmm. And that's very expensive. Now, obviously, like baseball and volleyball, they do all this travel. I mean, it's probably comparable now. Like everything has gotten very expensive to be a part of a select team.
But we took a sport that for a brief period of time had a little bit of a critical eye turned towards it. And every single sport then said, well, if they can get away with it, so can we. So we'll start having practices 2 nights a week, and we'll start having games all weekend.
Yeah.
And we'll start traveling for those tournaments. Yeah. And instead of having, like I grew up playing YMCA softball, and then I played softball in high school as well as some other sports. But in high school softball, growing up at Iowa, it was a summer sport. So it really wasn't that big of a deal to have 2-3 games during a week. Mm-hmm. But during a sports season during a week, especially even super young, we were playing, 1 game a weekend?
Yeah, I mean.
But now you don't get anywhere doing that.
I mean, if you look at the training facilities for the youth sports, is pretty incredible too. I mean, you've got indoor soccer, you've got a swing coach, you've got a pitch coach, you've got strength conditioning at the age of 10, all of which is fantastic resources. But when I was growing up in the 80s, there was none of that where I was.
A little bit of the 70s.
I was alive for 1 hour in 1979. So,
sir.
Okay, that's not. We digress.
But there was you kind of touched on it just there, but there was an orthopedic surgeon that we had the pleasure of being able to do kind of like a continuing education course with. It was very one-on-one.
It was great. It was an anatomy lab.
Yeah.
It was great.
Hosted by Creighton.
Mm-hmm. Good job, Creighton.
That somebody asked him just kind of in general, like why were there so many more female ACLs than male ACLs in the counterpart sport, which I think we've talked about before, is that it's 4 to 8 times more likely for a female to tear her ACL compared to her same sport male counterpart.
Correct.
And generally speaking, we're looking at, like female to male soccer players. You're looking at
multivariables,
female
obviously.
to male basketball player. Yeah, things like that. And yes, you talk about all the regular things, the training effect and the, potential hormonal effect and the potential, like anatomy effects and things like that. But he also brought up a really interesting point, and I think this bears repeating over and over and over again, is that it used to be 10, 15, 20 years ago, the athletes that would have kind of ended up not being as competitive, we'll say. They get
Your
to a certain point.
B-level athletes
Yes.
who are not really ready for the big time.
Right. It used to be the select sports, those true kind of the extra special competitive leagues that were saying, hey, we're putting you on this travel sport or this travel team, and you're going above and beyond. You're doing a lot more than your YMCA or your community group. Now that doesn't happen. Now, if you have a parent who's willing to write a check or swipe a credit card, you have a team and a coach that's willing to take that player and that player's money. And so people who maybe shouldn't have been athletes competing at that level, all of a sudden become athletes that are competing at that level, whether they should or shouldn't be. And that's where you start to see some of those injuries too.
And therein lies the problem is now that youth sports has now become a multivariable business.
It is. It absolutely is a business.
It's absolutely. And it always... Well, my YMCA soccer games on the weekend where I could have like a red shirt or you turn it out and then the other week it was like blue, reversible.
Absolutely.
There wasn't a lot of money in that. Like my dad was the coach and we brought pop at the end of the game. Like it was like fun.
You had a treat list
first
off. But gosh, I remember
but there was,
said that.
Nobody's making money off of that.
Right. The jerseys that were reversible.
Yeah.
The mesh.
I had a red jersey and a blue jersey and it was the same jersey. It was a really thick double-sided jersey.
Ours was blue and white.
Oh, well, Nebraska has blue and red.
Well, yeah. That's
anyway.
I was kind of stuck on the treat list too. Yeah. I really feel like we should still have that.
Well, it is what it is. But again, we are digressing, but like it was so much simpler back then. That was for like the love of the game and the sport, and it was fun. And it's unfortunately people are being taken advantage of from the business aspect. And that's just, it is what it is.
Right. Well, I mean, it's not only the business of right then and there, right? Like you have teams that want to be competitive and that their parents are willing to pay as much money as they need to be competitive. And then you have the kids that aren't as competitive, but their parents still want them to be competitive. And so then they're not on the first competitive team, but they're on the second or the third competitive team. And so they're also going to travel, just not to as competitive of tournaments as some of the other competitive teams are. But it's a long-term investment. It's a long-term business.
It's a trickle up to the college level, which now is semi-professional.
Exactly. Now you have the parents who are kind of looking at youth sports as get their foot in the door for their scholarships, not just free education, but now we're talking about money, like actual money.
Well, I think that brings up a really good point, but part of the problem, and this is like a podcast all on its own, so I'll just mention it briefly.
I'm going to sneeze, sorry.
Have at it. This is for another video of the pet peeves about our spouses. We'll talk about that probably later.
Squash her down. I put it in a little ball and shoved it way down deep.
Okay, so the problem now is because it has become such a business at the college level, you don't walk onto a team and invest in the team and stay for 5 years and work your way up. You're a quarterback. You want to play right away. Well, back in the old days, you played backup for 4 years and then you played your senior year. But now, because of the transfer portal, you're going to have people moving around, job shopping, finding different places. Oh, my goodness. There is a cat. I thought he wasn't down here. And Clark is going to make an entrance.
Yep.
That's kind of the problem. Like, people can now job shop and get into themselves in trouble. I'm worried about Clark taking this camera out. Hey, what are you doing? You're not even supposed to be down here. Didn't you? So when you have athletes job shopping, hey, I'm going to play here for a year, and then I'm going to get good, and then I'm going to make a lot of money. So, the next year I'll go to somewhere better. I think that's a huge problem. I don't know why we thought that was a good idea. I don't know why anybody thought that was a good idea ever, but it's here to stay. Claire may not have...
entrance back in.
I don't know. He probably needs to go upstairs. I thought he was upstairs. He's a real pain. He opens doors. He's basically a human with really soft hands.
He's a dick.
Yeah, that's explicit material is what that is, Claire. Let's keep it.
I'm sorry. Okay, so to wrap this up, right? But how do we see that? How do we see that in the clinic? So how do we see what's the main difference that you've seen in your 17, 18 years of treating people? 18.
I just see kids under a lot more pressure, and I see more of them who don't want to go to college, even though they're almost... I've got people that I've seen that are Division II, Division I level athletes that kind of just don't want to play anymore, which is incredibly sad because they're talented, they coach, they work hard, but they want to be a regular person again. They want to be a college student. They don't want to play sports because guess what? When you play sports in college, that's like a job. It's your job.
I think also we see some very adult-like injuries and some very young, skeletally immature.
Serious injuries, multiple ACLs, fractures. Obviously, we haven't even touched on the concussions.
Right.
I mean,
oh yeah, gosh, that's talk about a skyrocketing population of the concussed.
2 million youth concussions per year.
And what are the biggest sports? It's not. I mean, football is in there, but it's not.
It's not number one.
Right.
Soccer is huge.
Soccer, ice hockey, cheerleading / gymnastics, and American football.
Yeah. So it's not just, your high impact sports that people are hitting each other. All sports are subject to it. Some sports are obviously worse than the other, but 2 million children are losing consciousness or having permanent or the threat of a permanent injury
having
to your
a brain injury. Absolutely. Yep.
Yeah. Like we don't even spank our kids anymore, but we're going to let them go play sports where they have 2 million a year. Absolutely. That's incredibly high.
But I also think that, I touched on at the very beginning, is that the injuries that we saw when at a certain age group, and now we're seeing them 10, 15 years younger. So some of these overuse injuries, the tendinitis, tendinosis, the ACLs that down the road are going to end up causing, probably some dysfunction. Haven't even touched on things like baseball pitchers, shoulder injuries and swimmers, elbow injuries and baseball pitchers.
Well, look at an injury like an Achilles tendon rupture. 20 years ago, super, super uncommon in any young person, especially female.
Oh, absolutely.
Extremely rare.
And who do I have right now? On my case, I have a just turned 18-year-old competitive cheerleader who ruptured her Achilles.
Which, if you look at the last 20 years of our careers,
that's for people who aren't in the medical field, that's not the demographic that an Achilles tendon tear happens to.
That is a very rare demographic.
Now, luckily, the upside of this is everything that we talked about in the beginning about the positives that come out of youth sports. Learning how to be coached, learning how to lose, learning how to overcome, some negatives, and learning to take feedback. The other positive that I will say is if you're going to do something terrible to your body, at least give yourself youth on the side of trying to beat it.
We talk about recovery. That's helpful when you're young.
But, I just can't help but think, and I'm just thinking out loud because it makes us money and it helps. We're still doing a good thing by treating these kids and getting them back onto the playing field,
And for every one that is burned out, there's 10 who still love what they do.
Right, and want to get back for all of the right reasons. But you just think that, my gosh, like I'm doing something now. What's gonna happen to this kiddo 20 years from now?
Yeah.
I had a horrific knee injury that I helped rehab, along with some fantastic orthopedic surgeons and a neurosurgeon that helped, or a vascular surgeon. And it did great. I mean, the kid did great, went back to sports 100%, but I can't help but think 20 years from now, like he's absolutely going to have a knee replacement, if not something more.
Yeah. I like to ask a lot of random questions in the clinic. It's really interesting. One of my favorite questions is, if you could talk to your 18-year-old self, and presumably you would listen, what would you say to that person? And a good friend of ours who played Division I football just looked at me and said, I would tell him not to play college football because of the amount of injuries that he sustained and now continues to sustain in his 40s at a rate much higher than a regular person. And I'm not like anti-football or anything, but sometimes we forget that the things that happen to us when we're young, most of the time you heal, but do you ever really get away from that?
What's the long-term
Is it worth the risk, right? Like, is it worth it?
And I think it's always hard to have this conversation because we're going to end this particular episode the exact same way, is that how do you have this conversation and you talk about all of the concerns with youth sports? But obviously as I said in the very beginning, we're huge supporters and proponents of youth sports
is fantastic for young people.
So, and I say that to a lot of parents too, who kind of will say like, well, what's the answer? I don't know. I mean, this is essentially just kind of like an informational ranting session. I don't have a solution to this.
I don't know
think
that there is a really good solution with the state of how things are more business-like. I don't think that's going to go away. Right. I think it's great because there's more opportunities for people, but there's a flip side to that.
Just as an example, you know, you and I both know that there's a concussion protocol that they come out with now. Mm-hmm. Great, it exists. Doesn't mean it gets used. Because for every single person who wants to take a 7-day protocol to do things the right way, there's someone who's willing to say, hey, you know what, I'll let you go back in 6.
Yeah, and getting a young person to be off their phone for 7 days during that protocol, it's not very realistic. It's like having a golden retriever have a surgery, and you're like, oh, don't let your
we know
dog
that there's
jump.
Know there's pitch counts for baseball, but I mean, hey, if you can only throw 120 pitches this week because you're this age, well, okay, the kid's like, if everybody else my age is only throwing 120 pitches, what happens if I throw 240? I'm twice as good as them. I get in twice the practice.
Yeah.
So, I mean, how do you change that mentality? Because that mentality is going to be what makes these kids great. It's going to be what makes them the sort of adult that we were just talking about, takes those life skills. Hey, I can work harder. I can work smarter. I can be better. I can put in more work than my coworker, and I get a promotion. Yeah. Or I can do all of this and I sign a $12 million NFL deal.
Yeah. Unfortunately, we don't have a lot of answers for this one because I don't think this is a solvable problem necessarily, but we definitely have a lot of opinions, and we see it firsthand literally every day in the clinic. Without that demographic, our business wouldn't be what it is today.
Right. And so I guess...
And I love that population.
Yes. And
but
I guess
am
that's
concerned.
That's our part of the solution, is just trying to educate these kids when they come in, is to
and their
do
parents.
Our part. Comes down to everybody being as good of a coach as you can, right? Like teaching these kids solid mechanics, teaching these kids
prevention,
exactly,
mobility,
drilling into these kids that this is a lifelong thing. You need to stay active. You need to take your rest and recovery, take your injuries seriously. And I guess we do our part and kind of grin and bear it.
Playing your sport alone is not enough to be excelling at sports. You have to do mobility. You have to have recovery. There is some weight room for generally most sports.
You have to seek expertise.
Correct. And you have to have a good way to self-analyze your own ability and mechanical whatever you're working on.
And as I always like to say, more is not always better. More is sometimes just more.
Correct.
So when you're out practicing, quality over quantity.
Yeah, there's diminishing returns with practice with anything. At some point, practicing more, you actually will go backwards.
Yeah.
Generally, especially if it's skill-based, if it's athletic-based, maybe not. It depends if you're recovering. But if you're skill-based, your brain can only learn so much in a given amount of time, depending on who you are. You can't keep force-feeding it. And if you do too much, you will go backwards. Such is life.
So I guess that's just kind of a rant session without any particular solution. But
I don't know that there's a solution, but
I think I speak for both Mark and I when we say we do what we can with these kids, right? I mean, I think, you have a short-term solution a lot of times for people who are athletes that are in season. But I think you and I always do, or we strive to do our very best to have a long-term solution for these things as well.
Yes.
Okay, let's solve the problem, but also let's prevent the problem if we can from ever returning.
Well, and when I see a lot of athletes that are, at the end of the season, 2-3 weeks, we got state, we got end of tournaments, whatever. During that time, my treatment is generally maintenance or management of symptoms until the off season, if there is one. Unfortunately, there isn't always an off season now. We fix things in the off season. During season, it's really hard to fix things because you would have to stop. And because of the business nature of the sports, you can't take time off of sports.
Sometimes there's not an off season, which I think is...
It's a problem, but like I said, it's a business.
But if this topic interests you, then there are plenty of recovery stories that you can check out. COREOmaha.com, our Instagram, C.O.R.E Omaha, and then our Facebook page.
Yeah, I think we might just have a whole podcast on ACLs one of these days. Just alone.
We got a lot of things to say, and you're going to hear it. But
whether you like it or not.
From Claire, Mark's wife.
And Mark, Claire's wife. Depends on the day.
We're out.